Now, a significant number of COVID-19 patients in Kenya have become critical, requiring intensive care. Well, for doctors and nurses, it has been a battle against a virus whose manifestation has been rather unpredictable. In some cases, it has been a wait-and-see scenario. Well, tonight, our reporter, Enock Sikolia, looks at the challenges men and women in the intensive care units have had to bear since the first case of COVID-19 was reported in Kenya 100 days ago.
It has been 100 days since the first case of COVID-19 was announced in Kenya. But for doctors and nurses in the intensive care units, it has been 100 days of aiding seriously ill COVID-19 patients recover and shed off the virus.
So when the coronavirus came out, one of the things that I was like, it is one of those just other coronaviruses. It's going to be a small outbreak. It will go away. But when you see how coronavirus affects a patient, when you see somebody go from requiring no oxygen to bring on a breathing machine in the next 24 hours, it kind of takes you aback.
Weeks after Kenya had reported her first case of the zoonotic virus, Dr. Martin Musundi was drafted in at the Aga Khan University Hospital to head the critical care unit. Having practiced in respiratory care in Illinois State in the United States, Dr. Musundi was brought in to steer the unit at a time the country and the whole world was battling the COVID-19 pandemic. He says the moment COVID-19 patients started getting into the ICU, he knew it was time for his team to stretch.
When I walk into a COVID patient's room, of course, there's a little bit of discomfort, kidogo, even though I'm wearing all these clothes, I'm wearing all the protection that I can get. But yes, I mean, patient coughs, you have to look at it funny, but nonetheless, you do not show your fear. You are there to take care of the patient.
Dr. Musundi says most of the patients who ended up in the ICU have been extremely sick. And so you have to be in their shoes to feel what they feel. Giving full attention not only to the physical state of the patient, but also the psychological state is very important. He says you sit there and talk about something that is totally unrelated to COVID-19. You just ask details about them.
Thank you so much.
So that you get to know them and their families. Because when in ICU, they can't talk to their families. Doctors and nurses here become the bridge. And with that comes the burden.
One of the things that you're worried about is if I leave this guy overnight and go home, I might come and find him not there. So that is one of the things that weighs very heavily on your mind.
Given that there is no known therapy against COVID-19, the idea has been using tricks that have worked on patients that have been really sick in the past. But Dr. Musundi says COVID-19 has been proving problematic.
I want to tell you something about COVID. It is very unpredictable. Things that we assume that we knew, we do not know. A lot of our assumptions, a lot of our preliminary studies ended up getting turned upside their head.
At times, doctors and nurses are stretched to the limit and drained, especially when patients' oxygen levels are dropping and there is really not much they can do other than let their family know. At this facility, one man reached this stage. His name was Bishop Tim Wambunya. When we talked to him on the 30th of May, Bishop Wambunya told us how he was on the brink and it took the hand of God and the workmanship of the ICU team to be alive.
It reached a point whereby we were not sure he would live. But at that point, we knew God has the final say.
But they gently brought me back. I wasn't able to eat or drink.
I cannot describe it and say, we did this in the next minute and the guy bounced back. No. There's really nothing like that. COVID is a long-term game, especially when it comes to the intensive care unit. It's really just kind of keeping the body calm as it heals, supporting the body as it heals.
Dr. Musundi says the danger about COVID-19 is the damage it leaves in some patients.
So when you get to the point of cardiac arrest, there's quite a bit of damage that has been done. We still attempt CPR on those patients, but again, the outcome usually isn't very good. So bringing somebody back from the brink with COVID is a little bit different from other diseases.
Enock Sikolia, Citizen TV, Nairobi.